whenever you all are ready. Thank you. Good afternoon, everyone, and thank you for being here today. Last week, as promised, I shared that I will return back to provide an update on our school reopening. As we made an announcement today, I just want to remind everyone, since last week, we continue to monitor our data and remain in very close contact with our local health officials and our medical advisors. Today, the City of New Orleans has made an announcement that here in our city, data has improved. The city also will be moving to a modified phase 2 status for COVID restrictions. I also will say that this aligns with our plans and the trends that we also have been tracking here at NOLA Public Schools. And based upon the metrics, such as positive test rates and new case counts, we are seeing the trends that we all been hoping for. After being in close contact again with our medical advisors, I am so pleased to announce that our elementary and middle school students can transition back to in-person learning beginning Monday, February 1st. We will once again follow the phased approach laid out in our roadmap that has truly worked so well for us thus far this school year. So again, students in grades pre-K through 8th grade can return to their classrooms starting Monday. As we continue to monitor the data, we will also begin to phase in high school students with plans to fully return to our working hybrid model for our high school students after Mardi Gras break. On Monday, 9th to 12th grade students are allowed to provide, are allowed to provide in-person learning to small groups of 15 people or less for specific groups of students, such as students with special needs, those who are chronically disengaged, or those who are best served with in-person learning. We know that in-person learning is the best educational experience for students because it develops the whole child, academically, socially, and emotionally. And while I know this decision that I just announced for our high school presents operational and staffing challenges for some schools, but today I strongly encourage each of our schools to prioritize in-person learning for students under these protocols that I just described. I want to take this time to thank our parents, our teachers, staff, and students for their perseverance in these very, very challenging times. I also would like to take a moment to thank all of our New Orleans residents and our businesses. Without your discipline and willingness to mask up, stay socially distanced, wash your hands, and limit interaction with each other, we would not have had the option that we have today to move our youngest learners back where they belong, in the classroom, face-to-face with their teacher, and side by side with their friends. We are confident here at NOLA PS that COVID-19 has not spread in our schools because when our schools were open, it was our educators who did tremendous work by following the protocols that we put in place from day one, such as taking temperatures at the door, limiting class sizes, and distributing hand sanitizer so that they remain today the safest place for our children to be. We are also greatly anticipating what's going to happen with vaccinations. We hope teachers and all our support staff will soon be eligible to be vaccinated. We are going to continue to coordinate with our schools and Children's Hospital in anticipation of the day when our educators can be vaccinated. It takes all of us out there in the community to stay safe and to keep our children safe and learning in school. So let's keep up the good work Together, we can do this. Now I'm going to ask my Chief Operations Officer, Tiffany Delcourt, just to come up and give some additional information that helped to guide us to the decision that I just announced. Tiffany?
Thank you, Dr. Lewis. As you all know, we monitor a host of metrics the state, the city, and our district use to track COVID-19 in our community. That way, as we have from the very beginning, we continue to make data-driven decisions that prioritize the health and safety of our school community. Throughout January, we have seen significant declining trends in both new cases, positive test rates, and daily averages. This afternoon, the Louisiana Department of Health released data from last week that showed the positive test rate in New Orleans is now 4% and now below our 5% value. We've also seen declining trends of new cases continue from the peak that we saw at the beginning of January. These two important metrics, plus sustained access to testing, stabilizations, and our hospitalizations, tell us it's the right time to transition to in-person learning for our youngest learners. We will continue to monitor data trends and the situation in our schools before returning our high school students to their hybrid model. The staggered approach allows us to be responsive to the needs and any unexpected changes that may arise. As Dr. Lewis said, and what we have proved this fall, is that school is the safest place to be when levels of community spread of COVID-19 are moderate to low. As a district, we will continue to do our part to keep it that way. Our staff and our teachers have ample access to testing through our partnerships with Children's Hospital and Ochsner Health Systems. Our students can get tested at Children's Hospital, our staff can get tested at Children's Hospital and Ochsner Health Systems. And we are continuing to explore ways to boost access to testing throughout our system. We ask schools and parents to contact our school nurses for more details or look at our website for more information about testing and other resources. We encourage everyone to get tested regularly and to let your schools know if you're not feeling well. Going forward, we'll continue to evaluate multiple factors such as trends in positive test rates, new cases, hospitalizations, and the availability of testing. And again, and I cannot stress this enough, we do not rely on a single metric to make these very important decisions, but rather a combination of all of these factors and how they relate to each other to give us the best overall picture of community health in our city. So again, we encourage everyone to do their part and stay safe so that we can keep our students in our classrooms for in-person learning as much as possible, like we did last semester. Thank you, and now we'll take any questions you may have.
Hey y'all, so we're giving each outlet two questions, so Della.
Hi, thank you. Vertically challenged. I just want to make sure that I'm totally accurate. Can you please explain again slowly who is going back next week in what class sizes and who is going back after Mardi Gras in what class sizes? Thank you.
Yeah, no problem. So for pre-K through 8, they're returning to in-person learning starting Monday, February 1st in the same model that they had when they left school in December. So that is classroom maximums of 30 and following all of our roadmap guidances. For our 9th to 12th graders, they are going to be in a more modified version. So they will be returning if based on those specific populations chosen by the school systems, the individual schools, in groups no larger than 15 persons, based on those specialized populations.
Starting Monday?
Starting Monday.
Okay.
And then they can return to their normal hybrid model that we had before the break starting February 22nd.
Got it.
Or no earlier than February 22nd.
So pre-K through 4th, Monday, 5
Pre-K
days.
through 8.
Oh, pre-K through 8 can be 5 days a week?
Pre-K through 8 can return in the model they were before.
Right, so pre-K through 4 would be 5 days a week.
Yes.
If they opt for that. 5th through 8th would be up to 2 days a week or more.
In the model determined by the school, which every school had a slightly different hybrid model.
Okay, and then high school would be no more than 15 per class, depending on who would need that. Okay.
Yeah.
And then
So,
after
but I think the main important point is pre-K through 8, exactly as they were
Got it.
at the end of last semester.
Okay, thank you. Do I have time for one more?
Yeah, that was one, two.
Okay, thank you. There was a draft matrix that I saw in a records request. And it was shared with teachers on February 4th, I believe. January 4th, sorry. Is there another matrix besides that that I should be aware of? And if you need to follow up with me after that's fine.
No, we use the same kind of guiding metrics to make our decisions. And again, I think that is the point of our press conference and my earlier talking points is that we don't rely on a single metric to make any decision. It is the holistic view of many, which included all of those metrics, which is positive test rate, which right now is quite low, cases, and also various trends in hospitalizations as well, which I think is all within the metrics we've talked about in the past and also moving forward.
Thank you.
You're welcome.
All right, Chairman WSU.
Good afternoon. We've been getting calls, of course, and emails from a lot of teachers who are concerned about the reopening, so I'll just stick with their questions, if you don't mind. This is one from a 5th through 7th grade teacher. The CDC released a study this week that found little evidence of major school outbreaks, but that was only when certain precautions were in place. 2 of those precautions were accessible testing and reducing community spread by restricting dining at restaurants and bars. In light of the city moving to phase 2 and your suspension of the school's mobile testing program, can you tell us more about your decision to open schools at this time?
Yes, I think as Tiffany Delcourt gave her information about where our trends are, and they've been trending in the right direction, is one of the main factors that we're able to look at. And then also I've shared that our schools here in NOLA, and yes, I read the CDC report as well, but our schools here in NOLA, as we think of the first semester, our schools have not been a place of spreading COVID-19. But I will say, and we're very appreciative of our educators because from day one, when we moved to in-person learning, they made sure each and every day that those protocols remain in place, and that has allowed us for the first semester from the time we started to actually be able to make it through the first semester. Of course, we had a little rocky start to the second semester following the winter break, but we know why and those things there, and our numbers were continuing to just go in the wrong direction. But today, as the City of New Orleans has announced, those numbers have trended back in the right direction and where we need to be able to make this announcement today to reopen our schools beginning Monday for our elementary school students, as we said, and the approach where we saw the same thing last semester, the way that we ended. And a different approach right now for our high school students, but we're very optimistic that after Mardi Gras break, our high school students can also return to their model that was in place prior to winter break.
In regards to that school mobile testing program, is that going to continue?
So I will say, and that conversation has been going on around the nation. But I will say here in the City of New Orleans and NOLA Public Schools, even though we have been given guidance that we were able to still continue that, out of abundance of caution until we get additional information, we decided to suspend that for this time. And when we are able to get the green light, then we'll continue that once again.
And historically, we've had spikes following the weeks following a major holiday. Even though Mardi Gras is quote unquote canceled, we're New Orleanians, we find a way to celebrate. They got house floats everywhere. So with the anticipation of another spike, can the teachers expect for their in-person learning and the things that they're doing right now to get interrupted once again?
So again, we also had Thanksgiving break, and we were able to return back to school after Thanksgiving. And so again, it takes an entire community Our mayor made it very clear a long time ago that the priority was in-person learning for our young people. So I hear the question that Mardi Gras is coming. Mardi Gras is very different. We know we won't be gathering the way that we should. And I'm also going to say that even outside of having parades, that we've seen from day one the impact of COVID-19 on this community here in the city of New Orleans. So I know what Mardi Gras means to many of us, but we have to make sure that we mask up, practice social distancing, wash our hands. If you're sick, stay home and get a test. Like, that's what it's going to take, because at the end of the day, our priority is in-person learning for our young people.
All right, thanks, Chairman. Fox, are you all good? Okay. Thank you, Dr. Lewis.
Again, thank you all so much for coming today. As I said last week, I was very hopeful to be able to make a positive announcement for our young people and for our families. And as our pre-K-8 return back to their model that they were in before winter break, we know we have a different transition for our high school students, but I'm just asking for our community, for our educators, and for all of us as a community to continue to come together to make sure that we are able to support our young people during these very, very challenging times so that they can receive their education even in the midst of COVID-19. This concludes our press conference for today, and I just want to thank each and every one of you. Thank you so much.